the meanings. Hyaluronic acid granulomas. Hyaluronic acid granulomas. Everybody now should know that this is almost the simplest thing we can deal with, for even after half a year, after 1 year, after 2 years. If you want to remove it, take hyaluronidase, and mostly even these hyaluronic acid granulomas will be dissolved or will get smaller so that they are not noticed like before. But there are colleagues who deal hyaluronic acid granulomas with 5FU. This is a crime, excuse me. This is a crime. So, but what I want to tell you is we have to learn, we have to go to the basics, how we do it with all our normal patients as well. The problem is those are not patients. Those are only, yes, they are customers. They are coming to us for lifestyle treatment. And lifestyle treatment, the industry all over the world tells us nothing can happen, everything is safe. And they give us weekend courses or workshops, one-day workshops, and after the one-day workshops you are the perfect laser guy, you can use it, it doesn't matter how, which kind of laser it is, use it, nothing can happen. You can implant threads if you are plastic surgeon, dermatologist, or proctologist. Everybody is running to earn this money in the aesthetic treatment, but if something happens, then everybody is in disorder. It's not like if you are treating patients in your daily practice, you are used to have complications. For if we are working, we have complications. Every one of us who is here on this stage and says that he never had a complication lies, or he is doing nothing. Yeah? This is our job. Sometimes shit happens. But we have not to lose our brain. We have to go step by step. And excuse me, Tanya, excuse me to tell this, but I think the reason is not to create on every congress a new society of this and society for a complication, for society for that. What we have, I think, this we can discuss, what we need is that, especially on such events, a meeting of the experts to find consensus solutions, first guidelines, how to handle, what is to do if there is, this is the simplest thing, what is to do if you have a side effect, yeah? First, taking blood, then perhaps taking some specimen to make histology. Then, yes, we have to start with antibiotics. We do this in surgery as well. Yeah, if we have the thought that it could be an inflammatory reaction and it could be a bacterial infection, we have to start with antibiotics. But we learn even on a simple cystitis to take first the urine and then to start with antibiotics. Those are the simple rules. And even me, I cannot deal with all the questions are coming up to me. But we have a network and we know, and we have phone calls all over the world. It's very simple today. We have Skype, we have everything. We can send pictures within seconds from Australia to Great Britain, to Germany, to Italy, everywhere in the world. And we can discuss. We need panels. Panels for expert for hyaluronic acid complication. Panels for experts plastic surgery. And even there, several groups, yeah, for oculoplastic surgery, for breast surgery, or for you start doing something, you have to know what you are doing. And you have as well to know what can happen. And the second is to know where to go if you by yourself are not able to handle this complication. For it is difficult sometimes, yeah? And even we, when we are discussing in our so-called expert group, we are sometimes different, with different meanings, yeah? But that shows us that it is difficult, yeah, to handle those cases. But some principles are very simple. For example, if you have a swelling after a filler injection 3 days later, and this is highly red and is growing up every 5 hours, yeah, what should it be? It can't be only an abscess. And an abscess, the principle of treatment of an abscess is, since 500 years, since Paracelsus, ubi pus ibi evacua, there is no need of antibiotics, for the antibiotics will not kill the abscess. Ali told us, if you open an abscess, you have as well to take off the capsule. But if you are not surgeon, only a practitioner, aesthetic practitioner, yes, then in this case you need the plastic surgeon or a general surgeon. It doesn't matter if the plastic surgeon is in 500 kilometers away. But we have to know the simple things. We have to know that if we inject here and we have a bluish discoloration in the center of the forehead, that it never can be a hematoma. A hematoma does not go upwards, a hematoma goes downwards. And we have Google, please Google vascular complications. Thank you for your attention.